She was at work when symptoms hit, a headache like no other, an aneurysm ruptured in her brain. If this happens, you have a 40% chance of surviving. But doctors at Mayo Clinic performed a surgical procedure that saved the life of the woman you're about to meet, all without open brain surgery.
Blue, stay. Don't get me wet.
Washing old blue may seem like a ho-hum chore to some, but to Susan Landmark, it's a precious gift.
They all told me I was very lucky.
Lucky to be alive after an aneurysm ruptured in her brain.
Started to get a very severe headache, and the next thing I knew, I woke up in the ambulance.
A near-death event that thankfully Susan barely remembers.
Dr. Handel kept going, this close, you came this close.
You see a little puncture right there? That's the aneurysm.
Dr. Ricardo Handel says this aneurysm is similar to the one Susan had.
The aneurysm is what we describe a blister on a vessel wall.
And if it ruptures, you need treatment fast. The standard procedure usually means open brain surgery, but for Susan, Dr. Handel used a much less invasive technique. No clamps and scalpels, just wire coils.
And the coil is nothing else than a wire, platinum wire, that you can detach or leave behind inside the aneurysm.
During the procedure, Dr. Handel inserts a catheter and guides it to the site of the aneurysm. Once there, he runs the coil to that site and fills it like a bird's nest. The patient's blood clots onto the coil and prevents new bleeding.
But it's extremely effective and very safe for the patients.
And much easier on the patients than standard brain surgery.
I can't believe it happened to me.
And now Susan savors every moment with her family, every moment of life. Dr. Handel says while this procedure is a good option for many patients, it may not work for everyone. Some aneurysms are best treated with open surgery. And again, getting treatment fast is key for surviving a ruptured aneurysm. For Medical Edge, I'm Vivian Williams.